Hi, I'm Dr. Hightower. I'm a chiropractor. Before we get started, I'd like to give a little background information on what's going on here before I get to the adjustment itself. Doctors have told me at different times that they have patients with sacroiliac problems, and after a couple days, the patient comes back and says, "Well, it was good, but it came right back." The diagnosis for these you probably have is maybe Thompson's PIIN or PIEX, maybe rotated sacrum. Whatever it is, this might be the answer. Today I'm going to show you how to do an adjustment that's usually not taught in chiropractic schools. It's called the pubic symphysis adjustment. And just from that name you can probably figure out why. And so, as you know, that this is a pubic symphysis, and if it's out of alignment, it causes the sacroiliac to be out of alignment also. We try to line up this, hoping it'll line up this. Obviously, on those cases, this isn't happening. Okay, now I'm going to show you how I proceed with this. Hi, Mrs. Jones. Hey, how you doing today?
I'm doing good, but that adjustment I had a couple days ago, the pain's back.
Really?
Yeah.
That's not good, is it?
No.
Okay, take your glasses and just lay them down over there. Okay, I'm going to have you lie down here. I'm going to do a couple checks on you, see what's going on here.
Okay.
Okay, just put your hands right here.
Oh.
Here we go. Okay. So what I'm going to do is a couple leg checks, and just to see if you got some restriction or whatever. Okay, let me bend your knees. All right. Now, without bending your knees, I'm going to hold right here, and I want you to lift this leg as high as you can. Well, that's good. Okay, do this one. Ah, that's a little restricted, isn't it?
Mm-hmm.
A little going on here. Okay. Since you got that restriction right here, I'm going to bring the table up, and I'm going to show you a procedure that might be of more benefit to you, okay? All right, here we go. Mrs. Jones, come right out here and just have a seat. I want to explain something in detail to you because it's a little different than we've done before. Okay, this model spine here shows the back of you, which is what we're checking, and you had one of these that wasn't moving like it's supposed to. Well, sometimes if that's caught and it doesn't seem to relieve itself from the adjustments, it oftentimes comes up here, and we call this a pubic symphysis. This is the part that spreads apart when you have a baby. It doesn't have to have a person that has a baby to have problems up here, but it is one of the problems that we see a lot of times. Now, these little bumps right here, these are pubic tubercles, and these are, you can feel these push on you. Down here is your private part, so you'll notice that I'm up here a little higher. So what I'm going to do is I'm going to check these things here for tenderness, and then I'm going to see if it warrants adjusting like I think it does, okay?
Okay.
All right. Now, there you go. If you feel uncomfortable at any time, then just let me know here. But what I want to make sure that you understand is I'm not trying to molest you. Well, there was a little lady, she says, "Oh, go ahead because it sounds like fun." But if you're okay with this, we'll proceed.
Sure.
Okay. All right, so what I'm going to do is slide my hand here until I hit that tubercle. Is that sore?
Ow. Yes, I didn't realize that.
You didn't realize it. Not too many people do. Okay, so we're going to check this one also here. Is it sore?
Not as much as the other side.
Okay. All right, so now I'm going to slide my fingers down here, my thumbs, and we're going to just check those tubercles, and then we'll see which one's higher than the other. Okay, so it feels like that they're rotated just a little bit, so I'm going to do this adjustment on there, okay?
Okay.
All right. Now, on this one, one of them is high and the other is low. So what I'm going to do is I'm going to contact that tubercle with my hand here, and we're going to use this drop table, and it's going to drop down. Okay? So what I'm going to do is find that right there. Right there it is. That's sore.
Yeah.
Okay. So I'm going to go like this. Okay. Well, that's all there is to it.
No,
Not the best feeling, but okay. All right, so this time I gotta push the other side up. There we go. You all right?
Yeah.
Now I want you to touch those sore spots and see if they're still tender.
No.
Mhm.
No, they're not tender at all anymore. Feels better.
Well, good. That's what we're trying to find out. Okay, I'm gonna bring you up. I can't remember anybody who objected to this procedure, but if I feel any apprehension or somebody feels like they might be afraid, I have my wife come in and stand in while I'm doing the adjustments. However, if there's a young lady who comes in and needs that adjustment, I definitely have my wife to come in and observe. Please feel free to make any comments in the section below, or if you have any questions. And thank you for watching.